Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. In today's video, we are going to talk about MPH in Australia after BDS with Dr. Priyanka Salunke. Dr. Priyanka Salunke graduated from Srinagar Dental College and Hospital. She also holds a master's degree in public health with majors in occupational health and safety from University of Wollongong, Australia. While she worked as a health and safety officer and accreditation representative in Australian dental clinics, she also developed and presented educational sessions for infection prevention and compliance in dental settings. She is an active member of Australian College of Infection Prevention and Control. Dr. Priyanka has now established an infection control consultancy NearZero Dental Infection Control India for private dental clinics of India. She trains dental teams on the health and safety protocols and best practices of infection control in their dental clinics. Hi, Dr. Priyanka. My first question to you is why did you select Australia of all the countries out there? And why MPH? Why not something else?
Well, I would start with why MPH. I worked as a dentist before moving to Australia for 4 years in India, in Mumbai. And the dentistry is like a lovely field, but the kind of stress it comes with, there's high incidence of stress and anxiety that comes with this job. And that's when I realized, like very early on in my career, in like couple of years, I realized that this is not the only field I would like to pursue all my life. So I thought I should look for some non-clinical courses, and hence MBS was also off my list. So I researched for MBA in healthcare and masters in health administration, and of course public health, where I thought public health has better scope comparatively. And I just hired a consultant, to be honest, who like took me through it, and I signed up for it. And
Okay.
Australia only because um, I come from a very protective family, so we just knew someone in Australia, and my parents thought, you'll be better off there, and it's good climate, and also Australian universities are comparatively cheaper compared to the US. And then I thought, okay, let's do it. Let's go to Australia.
Okay. So you hired a consultant. So was the process very difficult, easy? How was the process, basically?
It wasn't very difficult. They basically take all your transcripts, and your statement of purpose is most important in this process, as in they want to know why you want to migrate, why do you want to take this course, and how it's going to help in your career. So, statement of purpose is, I think, a very important document in securing admission into this course. And then, of course, your proof of funds, and if you have a student loan, documents for the student loan, for the visa. That's all you need. Like that's all you give to the consultant, and then they do the process with you.
Okay. So how was it there? How did you find Australia? The university, the life there, was it difficult, easy? Any problems you faced per se?
Well, it was a very different life. Difficult to start with, because I had to do part-time jobs along with studying, which is very different for us Indian kids, right? We come from very
Pampered
secure.
families.
I know, we live in a shell, we don't pay our bills, so we don't know how to live on our own. So it was a very different experience, right from delivering pizzas for Domino's to
Oh,
working in takeaway shops to working as a wait staff for Indian fine diners. I have like done it all in first few months. So it was, and then managing studies, like managing a master's degree with these part-time jobs was a very different experience. But it was difficult as well to pay my bills with these jobs. Um, but I managed it, and I think those days, first 6 months, were the most difficult and most memorable days of my life.
So it might
Now
have
when I look
changed you,
back,
right? It might
sorry.
have changed you, I said, as in your
Completely,
perspective
it
and
made
everything.
me like very humble. After working as a dentist for 4 years, snapping at your assistants, you directly go to deliver pizzas and work as a wait staff. It's a very very humbling experience. I think everyone should have this experience at least once in your life. You get to know so many different people in this world, because I feel whoever signs up for a dental college, we are, among the top ones right from our school days. So we don't know what life is for other workers. And when you start working with them, you get to know their perspective as well. So it's a very different experience, very, very humbling experience.
So did you get any job related to MPH when you were studying at that point of time? You joined any NGOs
Not
and anything
by
like that?
Not while studying, no. I landed up with a dental assisting job because I worked as a dentist here. I had this experience of working as a dentist. So I landed with a dental assistant job, but that was a casual job. I would hardly get any hours in the week. But eventually that job got permanent, and then I could leave other jobs, other part-time jobs. And by the second year of my studies, I could, you can climb up the hierarchy, and you can get better position in the same place, like if you work hard and if you gain the trust of your employers. So I managed to secure a health a head of staff position,
So
where
this
I
was when
would
you were
do,
studying or after you were studied?
yeah, while I was studying. So
Good.
I started doing rosters for my staff, um, doing their leave applications, doing their timesheets, doing their performance reviews. So I could, I did learn everything about the management aspect of a dental clinic. Earlier, I knew only the clinical aspect. So I, kind of, you get to learn so much when you work on the front desk and in a managerial role, which we are never trained in the in our dental schools, right? So learning about stock take and how to budget your expenses in the dental clinic. So being a head of staff, uh, it was basically all HR duties, and yeah, that's what I did in the second year. And after I graduated, I mastered in public health. So I had specialized in health and safety, and that's how I could, at the same dental clinic, I got this position of health and safety officer, where I would do all the policy writing for our clinic, and ensure that the health and safety is followed at every procedure, at every level. Um, then we would do health and safety audits. There are
So
things
every
like,
clinic has this health and safety manager out there, or specific clinics had it?
not every clinic doesn't have a health and safety officer. They freelance it. I mean, they get consultants to do audits and stuff. Um, or when the officers from the dental board visit, they have to be sure that they are complying with all health and safety regulations. So because I had this degree, my employer gave me this role where I could, where I had learned all OSHA standards, occupational safety and health administrative standards. So I started applying it to our practice, and it really helped the practice in only for the better. Yeah.
So how's the job situation there and then the opportunities after finishing MPH in Australia? How is it?
Um, I would say you can start with a research assistant job um, at your own university, or you can look for health promotion officer jobs. Obviously, health and safety is there. Then there is epidemiologist jobs. So there are jobs, but getting into the jobs, like, I mean, penetrating the market is very difficult for immigrants. Most of the jobs have requirements that you should be a permanent resident or a citizen. So it's like a
So
circle.
getting
Like
a visa is a problem basically.
yeah, that is there. So you have to be either a resident or a citizen to get into these jobs, and if you want a PR or a citizenship, you need to have work experience in that field. So
It's
it's
a
quite
vicious
tricky,
cycle.
but then it's all about creating that opportunity for yourself. If I wouldn't have created this opportunity for myself, I would keep working as dental assistant, or I would keep working in different part-time jobs. So specifically for our generation, it's a bit hard compared to our older generation. They would finish a degree and they would get a job straight away in their field. It's not the same with us. We have to struggle a bit, do super specialization and do few more courses to excel and to prove that I've got the skills, so please give me this job.
So it's basically
So
not the degree you have, it's what you do with it. Basically, you
exactly.
created a position for yourself. So that
Yes,
helped
I
you
did.
out.
Yes,
Okay.
definitely. And then this was my first job. So after that job, I could apply for other practice, apply to other jobs with this experience. And they hardly had anyone with the same dental background and health and safety background. So I had a very strong profile, I would say, to apply for jobs in a dental clinic. And I never wanted to get out of touch from dentistry as well. Although I love dentistry, it's just a bit stressful field for me.
So now, if a student goes there, does
Yeah,
MPH, is not able to get a job out there,
yeah.
once they come back to India, are there
Mhm.
job opportunities available here in India?
It's not quite straightforward in India, to be honest, as much as I have researched. But you can apply for positions in Indian Institute of Public Health, or work for some NGOs, or again look for some epidemiologist jobs. But I strongly feel that it's an upcoming field, but not no straightaway jobs, in my
It's not very
opinion.
easily available as of
No,
now.
no, not
Okay.
as much. Yeah.
So when you came to India, you made a niche again for yourself. When you didn't find an opportunity, you made one. So tell me
No.
about your venture, NearZero, how it
Okay,
is,
so
what is the vision, mission behind it?
NearZero is an infection control agency, like a consultancy for private dental clinics. It basically ensures your health and safety standards and infection control guidelines are followed, and the standards are up to the mark with international standards. So it's a 1 day, single day on-site course where I go and train entire dental teams together. So I make sure that they have their principal dentist, their assistants, receptionists, they're visiting faculty as well in those trainings. And then I teach them the basics of infection control, right from hand hygiene. Or rather, we were taught, but we never practiced, those 5 moments of hand hygiene and stuff, or how long our nails should be, what ornaments we are supposed to wear, or very, very basic things like our work attire, to how to wear our PPE, and how to not wear your mask incorrectly. I have seen so many dentists wearing 2, 3 layers of mask, but then if you
None of them are
wear
proper.
yeah, if you wear N95 on a cotton mask, like it's not going to help. N95 is supposed to seal on your face. You can't wear it on another mask, or you can wear N95 and then another surgical mask maybe. But yeah, correcting these simple things. And then procedure setups are important, making sure everything is set up before the patient comes in, how to wipe down the surgeries. There is overlapping method of wiping down the surgeries from least contaminated to most contaminated sites. And then how to carry your instruments from your operatory to the sterilization areas, or how to set up your sterilization area. Like it is so crucial. I mean, you can't really have a small bench, or you can't really keep your autoclave on the floor and um, sterilize your instruments, you need to have a proper sterilization area. Or I tell my clients that buying a Class B autoclave is more important than buying a second dental chair. I mean, if your patients are trusting you, they are visiting you, they're your loyal patients, and you have to ensure that highest level of safety and care and the services that you provide. So these things, and then advanced techniques like batch control identification, um, doing performance tests for your autoclaves, and UV sterilizers, or how to bag your instruments. You can't all your instruments in one pouch, and you can't pile up pouches on autoclave trays and put it. That's not the way the steam is going to pass through the instrument pouches, or it's not going to touch all surfaces of your instruments to sterilize it. So basics like this, and then maintenance of your water lines, very very important. Maintaining water lines is so important. The biofilm that accumulates in the water lines, how it can cause infection to your patients, or um, maintenance of the suction lines. So just these important things, I just try to reinforce that infection control is the foundation of your dental practice. You can't really take it very lightly, and it should be your top priority.
So do they get a certification? Anything of that sort is available when it comes to infection control? Like how you have the OSHA protocol abroad, there's no
Yes,
set protocol in India. So
no, it's not.
can they show their patients they're doing something better for them? Is it possible?
So I provide a certificate at the end of the course, which they usually display on in their reception area, and it simply ensures patients that their safeties are top priority and stuff like that. Many of my clients use it for promotional purposes.
Okay, so if someone wants to get in touch with you, is there any website or something where they can contact you related to this?
Yeah, I have a page on Facebook, and I have a page on Instagram,
So
where
I'll
you
post that on our Instagram page so the people interested can contact you through that.
Yes, please. That would be great. And
Sure,
then I also have a website called NearZero Dental, uh, and all my contact details are there on that website.
sure. That's really great. Before we end, what is your advice to students who are planning to take MPH in Australia or follow the path you have taken basically?
Um, I would say that just do your research. Don't go by the consultants, because the world is very different to what the consultants tell you. Of course, take their opinion, but do your research, take your decisions. And what path I have followed, you might not be successful in that path, and everyone has a different path. So, and also I feel that students who want to pursue studies abroad, they should have few years of experience in India, because that really helps you. With my experience, I feel I wouldn't have landed up with a dental assistant job in such a nice clinic without having experience. Otherwise you have to start at a very basic level and then progress. So having few years of experience as a dentist in India would really open your eyes on what you want to pursue, or what you want to do with your life. Otherwise, students these days, I feel they just want to move abroad, and as soon as they finish internship, they look for courses and move without practicing. And how much of the exposure do we have in our dental schools? And these days it's even gone lesser because of COVID and things like that. So it is, I highly recommend to practice here for a few years and then move there. And just grab any opportunity that comes in your way. I mean, no job is small or big, it will just add to your experience. And yeah, just carve
So
your own
basically,
path.
they need to spend some time here, know all their options they have, and then grab every opportunity they get.
Yeah, make an informed decision, I would say. Yeah,
Understood.
and failure is a possibility, and so is success. So just go for it. I mean, you don't have to. Um, I, I have got so many students calling and asking that should I take this path, should I take that path. I can't really say. I can only give you my experience and you make an informed decision whether it will suit your life or not.
Understood. It
Yeah.
was really nice talking to you. I'm sure the students would have got a lot of idea of MPH in Australia after BDS. I thank you for giving your valuable time to us.
My pleasure. Thank you for having me, Dr. Satish.
Thank you.
Thanks.